Well, of course, let you take your seat, but then I have a few questions for you guys, and then I think we can open it up to the audience for some questions. And with this first one, I realize I'm taking a big risk in a room with quite a few researchers in it, but I'm hoping one of you can run a block for me if the stage gets rushed. But looking at gaps, a few years ago, we recognized a gap. And it was that there was money for research, but there wasn't necessarily money for implementation of that research. And so what we did is that's one of the reasons we did the Commitment to Healthy Communities, is to create common metrics based on research-backed evidence. And so we'll start with you, Ryan. In your work at PHA, are there gaps that you've found and want to share?
Lots. It's funny you say that because and thinking about this, I mean, the gap, and I started to reference it before, I think, is that we focus so much. Oh, a mic. Thank you. Thank you. Sorry. I was saying, as I sort of referenced before, we recognized internally that we are focusing a lot on supply and not enough on demand. And it was actually looking at some research that sort of inspired this metamorphosis, this evolution, which was, we had seen that research on Sesame Street characters being placed on broccoli and with preschoolers. I'm looking around for nodding faces, but in short, it was, if Elmo was on broccoli, a preschooler is more likely to pick broccoli over a carrot. Over a cookie. It worked for apples too. So we're like, wow. So we negotiated a partnership with Sesame Workshop. The problem was, the carrot companies, the apple companies, the broccoli companies couldn't afford to pay the licensing fees to get those logos to put on their products. So we negotiated a partnership with Sesame Workshop, whereby they agreed to give their licensed characters for free to any fruit or vegetable grower for 2 years. They've now extended it, and it's 5 years. Very proud of it. But personally, I was at home finishing that deal, you will remember this, on the phone, conference call, my own young kids at the counter, throwing food at them, feeling pretty good about myself. We were about to close this deal, and I hung up, and my own son said to me, "Mom, I am not going to eat an apple if Elmo is on it." I was like, dude, I worked really hard on this one. But I know, he was older. He just aged out of that demographic. And I said, well, buddy, who would get you to eat your vegetables? Because it's clearly not me. It's not Elmo, it's not Big Bird, who is it? And he just looked at me and said, LeBron. and at the time, Stephen Curry, who I didn't know who that was. And for my daughter, it was more like One Direction boy banders. And so I went into work and I said, we're gonna get them. We need the real life licensed characters. And so we spent about a year working with people across the country and celebrities, but that was the impetus for F&V, which is this fruit and vegetable marketing campaign that we have asked the top names in Hollywood, in music, and in sports to lend their name and voice and image to this advertising campaign so that we don't just see them in sugar-sweetened beverage commercials. The reason that my son wants a lot of those things is because he thinks he will drink it, he will eat it, and he will perform like Stephen Curry. Well, now I have Stephen Curry and broccoli in my ads.
That's great. That's great. Do either of you have any?
Yeah, I have just one. I think this was mentioned several times, but just the disparities across communities and how do we build something that is actually useful and tailored to different communities, because we know it's not one size fits all. And so I think the uniqueness of the work that we're doing sort of complements a lot of the work that Ryan and the team at PHA are doing, in that we're going directly to the communities. And so the folks that are in each room are the businesses and the stakeholders and the nonprofit organizations and the government officials within that community, so that we're able to foster and tailor everything community by community, region by region, and state by state, as opposed to just sort of a broad stroke that isn't, that we're not able to implement in all communities.
Sure. LuAnn, would you like to? Okay. Well, you brought up disparities, and reaching underserved communities is important. General Mills regularly publishes their responsibility stories that talk about how they're creating sustainable agriculture, but also promoting food secure environments. And at Healthy Weight, our programs focus on reaching those underserved communities. Last year, our prizing programs had 66% of them came from Title I schools, so schools with high degrees of children receiving free and reduced price lunch. But how do your programs focus on reaching disparities, or do they, and or how do they reach them?
So most our member organizations, by and large, aren't really collecting that kind of data. So that would be a gap for us, is that we're not really able to say a whole lot about that. There are some companies who do, but most do what they do for all employees.
Sure.
It's something that we are constantly focusing on, and we will sign big commitments with Subway or Mars Food, and that reaches everybody, general population, but then we'll do things like our affordable housing initiative or our convenience store initiative, which is an intention to get big companies, but who are already in those communities, and to work with them. But we're constantly challenging ourselves to do better and to do more with an equity lens.
So I think we've all seen how, in some ways, business practices have also shifted, and wanted to talk about that. At Nestle, they call it creating shared value. PepsiCo calls it performance with purpose, and Smucker's is looking for meaningful meal times. So there are a lot of different ways that it's being approached, but how have each of you seen kind of these business practices shift over the past several years?
Sure. Well, you missed Campbell's Real Food.
Yes. Apologies.
So I can certainly say, and in particular being within the Corporate Citizenship Center at the foundation, they've sort of seen this all across the spectrum, and I've seen it particularly in health and wellness, as we're no longer seeing companies sort of silo a bucket and call it, corporate social responsibility, so to speak. It's becoming embedded in who these companies and these brands are, and it's happened over the last several years, and I think will continue to, particularly as we're seeing newer companies build an entire business and model around embedding social impact around health, wellness, food access into who they are. And we're seeing a lot of these older and bigger companies, as Becky's mentioned, that are actually making a conscious effort to launch and start new campaigns and new commitments. Several of which PHA has worked with and worked very hard to garner, what is meaningful, what is impactful, and what will really create change and sort of transform our brand, so to speak.
Yeah, well, I have seen a shift just in the last 5 years, while being 5+ years at PHA, but I think my perspective, I spent a decade before coming to PHA at a big law firm here in town and working in the food practice. All my clients were big food companies and trade associations. So if I walk back from the beginning of that tenure to now, I've seen an incredible change. Without disclosing too much, I know some of my old clients are in this room, but sitting in boardrooms 15 years ago, when obesity was on sort of the lower part of a meeting agenda with some other liabilities to mitigate, like BPA and acrylamide, sort of depended on what month it was, to now working with companies and seeing obesity, or I should say health and wellness, be in the opportunities section of an agenda. It's something that not just the health and wellness or nutrition professionals in companies are championing. We are hearing from CEOs. We're having CMOs coming to our meetings. It's now an opportunity. They're hearing consumer demand. They're hearing the voices of their employees and wanting to do what they can to create healthier products, but also create healthier workforces. I just think we talk a lot about culture shift here. There's been a real business culture shift. I think it's really moving fast.
Yeah. So I would really second that. It's been wonderful for our audiences with inside companies that sort of employee health and well-being has been elevated to reflecting the corporate brand, reflecting, their image, reflecting what they're doing in community. So it's been a wonderful transformation.
Actually, just had one more thought as Ryan was talking. I think we've worked over the years to try to sort of bridge that gap between profit and purpose. And for many years, we've met with a lot of these companies, and the challenge has been, listen, it's great. We want to do everything that you're saying, but if it hurts our bottom line, we just can't do it. And we're finally able to build these case studies and show that consumer demand is shifting and that profit in many cases is staying the same or in fact going up because consumers are demanding shifts in the food that they eat and wanting to see quality and access and transparency. So I think that's just one more sort of.
Right. I think it's been great for us to see that at Healthy Weight as well, where companies can now make the business case for creating healthier products. So shifting gears to kind of the government aspect of this, Elyse, you've had 3 governors who have supported the campaign at the chamber. Ryan, obviously the First Lady, has brought obesity to the awareness of people globally, and LuAnn, the National Business Group, has wonderful experience in helping shape public policy around these issues. So I would be interested in hearing how the 3 of you think that the next administration can play a positive role and the next Congress can play a positive role in continuing these efforts. So LuAnn, I don't know if you have any thoughts and want to start.
I think that a lot more can be done at the state and local level in terms of incenting employers or corporations in terms of where they locate. And right now there's a lot of that going on. Someone earlier referenced, developers building walking paths and so on. So when you're recruiting, Target in Minneapolis to build their headquarters downtown, it's not just about job creation or, it's also about healthy workforce. Why isn't that part of it, or what they're doing for the health of the community? So I do think there's significant potential at the state and local level. And I'm also going to go out on a limb and say at the federal level, my organization strongly supports the employer exemption for health insurance premiums. Obviously, we hope that policy will continue under the next president and forever after. However, should it not, and we know there's a significant movement to change that, then I think there's an opportunity there at the federal level to create some kind of tax-favored benefit that won't be obviously the $250+ billion expense that we have now, but something for healthy workforces or healthy communities. And I think that that would be an opportunity.
Sure. I have to carefully watch my words. We at PHA don't engage in policy advocacy, don't do legislative work. But one of the reasons we were created was at the time, in the beginning of 2010, we didn't know whether this First Lady who had brought to national attention this issue had 3 years left or 7. And so one of the reasons PHA was founded was to continue the work. And we will continue this momentum beyond this administration. And without getting into personal perspectives on certain policies, I think we are just poised and ready to continue the shift, and it would be heartbreaking to see this momentum halted or rolled back.
Also to echo Ryan, at the foundation, we are sort of thoughtful about not engaging in legislative and policy specific conversations, but I think that the idea of the work that we're doing is to continue the work that's been done, and it is our job, community by community, state by state, and at the national level, working with businesses to make sure that this is not something that they're just signing up for now, and that they're actually focused on seeing this work through, and that they see the value and the benefit for them as well.
I think that's great. We also do not take positions on public policy at the Healthy Weight Commitment Foundation. But I have been told that time is up. Unfortunately, we won't be able to take questions from the audience, but many of us will be around afterwards if you have questions. So I want to thank our panelists and encourage you guys to get lunch and take a walk around the mall.